Hospitals and patients who live on the streets can get stuck in this cycle. For somebody who comes in to get treatment, then gets discharged into a dangerous situation, then ends up right back at the hospital. Denver Health is so sick of this cycle, it's creating apartments. Here's Mark Salinger.
In a city looking for solutions, a construction site provides some hope.
A 655 Broadway is a building that used to be an old office building.
On the corner of 6th and Broadway, a block away from the emergency room, fences block access to new apartments.
We can't make people healthy without housing.
Dr. Sarah Stella treats patients every day as an internal medicine physician at Denver Health. She knows the reason she often sees the same people over and over.
When people don't have a safe place to recuperate following hospitalization, they are likely to return to the emergency department in the hospital.
Sometime next year, Denver Health will open 14 apartments in this converted office building to be used for transitional housing. Instead of staying in the hospital for weeks at a time, people experiencing homelessness who have nowhere else to go will be released to an apartment to continue recovering.
They essentially are stranded in the hospital without a safe place to be discharged to.
Last year, Stella says Denver Health treated 7,000 patients experiencing homelessness, accounting for 30,000 visits to the hospital. She says the length of stay for someone who is unhoused is more than twice as long as someone who is housed.
One of the most powerful things I could be doing as a physician is advocating for the right housing and supports for my patients.
One building, 14 apartments, and perhaps a new way to fix a problem.
So we know that we can't solve homelessness in Denver, but we want to be part of the solution.
Dr. Stella says that she wants to talk about this because she says we aren't having the right conversations about housing in Denver. These patients are often older with more serious medical conditions. They need care on top of housing. These apartments will also offer resources and that medical care. They describe them somewhere in between a shelter and a skilled nursing facility, Kyle.
Mark, for all the conversation about whose job it is to solve the homelessness crisis in Denver, I don't know how many people before now were saying it's the hospital's job to solve it, but they clearly see a role because they're really up against it financially.
Yeah, exactly. So Denver Health tells me about 30% of inpatients that they have right now stay for more than 30 days at a time, and a portion of those are people who are experiencing homelessness. Denver Health can't keep doing this financially. They say that they're running out of money and need to come up with a solution regardless of what it is.
All right. Very interesting. Mark Salinger, thank you.